Good, good. Hi, folks. Welcome back to Dr. Gilead Show. On today, um, October 6th, 2016.
17.
2016. All right. So we are streaming live today on Facebook Live and also at WBGR Radio. This is Dr. Gilead Show. You can tune in Facebook, hit us on Twitter. We can also find us on YouTube. This is a show we talk about mental health, which is big worldwide at this time. Today, I have a special guest who's with me, Miss Caroline Trotman. Tell our guests about yourself.
Hi, I'm Carol Ann Trotman, and I'm a licensed clinical professional counselor here in Maryland. And my practice is with individuals, families, and couples. And I work with people on several different issues. So today we're discussing anxiety.
Good. Welcome to the show.
Thank you.
All right. And before we start, as we usually do, I would like to say these few things that please do not use whatever you hear on this platform to make a diagnosis of yourself or someone else. And two, do not treat yourself based on what you hear on this platform. It's always good to consult a doctor, consult a specialist, so that you can get the best treatment that is available. Dr. Gilead Show is not responsible for whatever anyone does based on what they hear on this platform. So please always get your doctor's opinion so that you can get the right treatment. This is purely educational. Thank you. Today we're going to talk about anxiety disorders. Anxiety disorders. Anxiety disorder is a diffuse, unpleasant, vague sense of apprehension that can be accompanied by physical symptoms. Sometimes people have headaches, perspiration, palpitations, your heart beating fast, chest tightness, sometimes some stomach discomfort, restlessness, all of those symptoms. These are just general symptoms that people could have. And statistically, we know that in the United States, it is, as a matter of fact, worldwide, is the most common mental illness. In our population, an estimated 40 million people, 40, whopping number, 40 million people, adults 18 years and above, have anxiety disorders. That means in our population in the United States of 318 million people, 18% of our 18-year-old adults, 18-year-olds and above, have anxiety. It is a big, big number. You can imagine that 18% of our society have anxiety disorder. That is big. It's huge. It's huge. And it's also known that 60% of females are more likely to have anxiety compared to men. I'm going to just talk about briefly about the age groups. Among 18 to 29-year-olds, you have 30%. About 30% of them have anxiety disorder. 30 to 34-year-olds, 35% have anxiety disorder. 45 to 59-year-olds, 30%. 30.8, as a matter of fact, have anxiety disorder. Above 60 years, as we grow older, anxiety disorder is less. 15% of our elderly have anxiety disorder. Looking at this, anxiety disorder is one of the most, it takes a lot of money to treat it. In our mental health budget of $142 billion in the United States, about $42 billion a year is spent on treatment of anxiety disorder. That is big. That is about 1/3 of our mental health budget. That is huge. And that is why we are talking about this particular mental illness today. Anxiety disorder includes several parts of it. You have things like generalized anxiety disorder. You have panic attacks. Also included in anxiety disorders is obsessive compulsive disorder, post-traumatic stress disorder, other things like social phobias, and we have other things like specific phobias. These are all included in anxiety disorders. But because it's a huge area of mental health, we're going to focus on generalized anxiety disorder. So, our main topic today is generalized anxiety disorder. Generalized anxiety disorder is defined as excessive anxiety or worry about several events or activities occurring more days than not for at least 6 months. So you have these people, they worry excessively and they have excessive anxiety feeling about several things, some important, some not important. And these activities could be work, it affects their work, could be they worry about work, worry about school performance, when really they should not. And the individual has difficulty controlling this worry. They know that they are worrying about nothing, but they can't help themselves. Ms. Trotman, I don't know, how often do you see an anxiety disorder, generalized anxiety, in your practice?
Well, I see that pretty often. I have several clients that I'm working with currently who have that diagnosis from mild to severe. But so I'm working with them on treating that, and it might be a co-occurring diagnosis as well.
Yep, and that is true. Anxiety disorder occurs in conjunction with other mental illnesses, especially things like depression. Depression is very common with anxiety disorder. A lot of the people who have anxiety disorder also have other things like depression and even substance abuse. So is a lot of the times it's not a standalone diagnosis, but people have things occurring along with it. All right, let's look at what are the causes of anxiety, generalized anxiety disorder. The thing is, nobody really knows. It's everything we know are just postulates. Nobody really knows what causes anxiety disorder. But one thing that is known is it could be genetically inherited or transferred to an offspring. I have seen a patient, the grandmother has it, the mother has it, 2 children have it. So it runs in families, which means it has a genetic component, part of it. And the ones that are genetically transmitted, there are what we call neurotransmitters, and these are chemicals in the brain, in the central nervous system, that have been implicated in generalized anxiety disorders. And these are things like GABA, which is called gamma aminobutyric acid. Don't worry about the name. It's one of those chemicals in the brain that affect people. Also serotonin, which we know has effect in depression, has also been implicated in generalized anxiety disorder. But also we know that our environment affects people, and this is the part of the part that we call psychosocial causes of anxiety. So the question is, are people genetically predisposed to anxiety? And then when they have stressors, in their life, in course of lifetime, the anxiety begins to present. So there must be some genetic component, because you have a lot of people who go through stressors, and yet they don't present with anxiety. But there are people who, even without any stressors, they have severe anxiety. And so these ones are the ones that we say are part of the psychosocial response. And these people who have the psychosocial part of it, they are people who generally they respond inaccurately or incorrectly to perceived danger. And that is, they perceive something that is dangerous when really it is not. So they worry about something that is not really anything. It's something that everyone goes through every day. But they worry about it, and they worry about it overboard. They go overboard in their worry. And they think that they are so incapable of coping. But this is what happens to everybody every day, and people cope. So that's why you have the psychosocial part of it. Now, if you look at male and female, anxiety occurs 2 times in females than in males. I don't know, in your practice, Ms. Trotman, is that what you see?
That's about right, yes. I do see more women for anxiety than I do see men.
Yeah, but also statistics show that the number of the ratio of people who seek help, even though some men may have a lot of anxiety, but they will not show. Yeah, because men are macho. They don't. They think that they don't need it. They can cope. And what happens? They now begin to self-medicate. Some people will drink alcohol. Some will use substances to calm themselves down. It works. Then, at a point, it will not work anymore. They continue to drink a lot, and they become addicted, and they get in trouble. So that is how generalized anxiety disorder can really pull people down. But I want to also point out here that there are other medical problems that can have symptoms that will mimic anxiety disorder, or even people who present like they have anxiety. And number one on top of that list is thyroid problems, hyperthyroidism. When the thyroid is overfunctioning, when thyroid hormone is very high, people feel nervous, the heart is beating fast, they are restless, they can't stay still, they just keep moving, they have difficulty sleeping, they cannot concentrate. And if they are not properly evaluated and diagnosed, you think it's anxiety, but it is not anxiety at that point. It is mostly from the thyroid. So that if the right doctors are met and the hyperthyroidism is properly treated, the people get well, and that is solved. The other medical problems are lupus, systemic lupus erythematosus. That also can present with symptoms of anxiety. Rheumatoid arthritis, cardiac problems. When people have problems with their heart, there's decrease in oxygen. People feel nervous, anxious. Even people who are having heart attack, they feel nervous. Sometimes they may not feel anything, but a lot of the times they feel nervous, the heart is beating fast, they're worried, and they go straight to the hospital. They get properly treated, and that saves the day, saves them. But it could present like anxiety as well. The other thing is hypoglycemia, low blood sugar. A lot of the times when we miss our meal, people get nervous, people get jittery and sweaty. That can also be misinterpreted or could present like anxiety. Even regular drinks, caffeine, that's another big one. We drink a lot of coffee, which contains caffeine, uh, even sodas. If you know how much caffeine in some of the sodas that we drink, you marvel. Other things like tea, regular tea. Regular tea contains theophylline, which is also a stimulant. When you drink any of these a lot, people could become jittery and feel nervous. Also, other drugs, stimulants, amphetamines, cocaine, LSD, ecstasy. And ecstasy is a big one out there, especially in parties. Young people go to parties, they share ecstasy, they take it. And the street names are things like X and Adam. You have things like dancing shoes, disco biscuit, and all that. People take all these and they dance, they enjoy themselves in the party. They get home, they become jittery, they become nervous. And if they continue to do it, they begin to have symptoms that are classical or that could mimic anxiety disorder. Now, we're going to look at how generalized anxiety disorder presents. Mostly, the people worry a lot for no clear reason. They just worry and worry and worry. Ms. Trotman, I don't know, the people you see, what kind of things do they present with when they come to your office?
Well, they're usually presenting with, yes, excessive worry about different things in their life, whether it's work or their relationships with family or significant others. They also present with trouble sleeping. They also present with just trouble focusing at work, or just focusing, period. They find that they're not able to hold a thought for very long sometimes.
That is another big one. People cannot concentrate. They just lose focus. And what happens? They get in trouble at their jobs.
They get in trouble at their jobs.
Yes.
Sometimes they're doing things that are mindless and dangerous, but not intentionally. Like if they're worrying about something and they run the red light, or so I've had some people that have had that happen fairly frequently.
Yeah. So those are some of the symptoms. Sometimes you see someone, they feel they feel like they are at the edge all the time. They're uptight. They can never relax. And you say, hey man, what's going on? Say, I can't relax. I'm tensed. And you look, you ask. There's really nothing that you could put your fingers on that may be causing them to feel that way. And because they're always feeling tired and tense, because they're always feeling tense, they get tired all the time. They feel fatigued. And Ms. Trotman has already talked about difficulty with concentration and focus. So, some of the patients I see tell me that sometimes their mind goes blank. They just feel this blankness. They don't know what is going on. They're there, but they're not there. That is another classical symptom. And because they have difficulty calming down, they feel irritable. Yes. They're irritable, they're angry.
Low frustration.
Yeah, they're very, very frustrated. Little things, they could yell at people. And who suffers? The closest person, the wife, the children. And so it's really tough on the individual. And also, most importantly, tough on family members. Even co-workers also get affected. Some talk about muscle tension. They get muscle tightness, headaches, and they also have sleep disturbances. Sometimes they have difficulty falling asleep. Sometimes some of my patients tell me they lay on their bed, they just cannot wind down. Their thoughts are racing. And some come to me, they say, oh, I think I have bipolar disorder. And by the time you take your time and get a clear evaluation, you find out that really what they have is simple anxiety. Yeah. So they go to bed, they can't sleep, they fall asleep, finally they wake up. Some wake up sweating, their heart is beating fast, and in the morning they feel like they were beat up at night. So these are all the symptoms that people have when they have anxiety. Some have their heart beating fast, palpitations, and some people tell me they feel like, oh, I'm going to have a heart attack,
Right.
and they run to the emergency room all the time. I've had people go to the emergency room 2 times a week, and that's why it's so expensive to treat, because they run to the emergency room. Of course, when you're talking about you're feeling like you're having a heart attack, chest pain, the first thing we do in the emergency room is put you on the bed, get an EKG done, just to make sure that really you're not having a heart attack. And that is a lot of money in the emergency room. So they go there, the ED doctors would get a chest x-ray, echocardiogram sometimes, EKG. Once they find out, whoa, the heart is functioning well, it's just that the heartbeat is so fast, then they give them little medication, they calm down, and they go home. And usually people are told, follow up with a psychiatrist, follow up with a doctor, but they don't, because they're feeling good. They go back home, and a few days, the same thing repeats itself. I've had people go to the emergency room 2 times a week, and they repeat it every week until someone says, no, we're not going to see you here anymore. You go see a doctor. Then they finally come. Because really nobody wants to see a psychiatrist, but they end up coming because it's something that needs to be treated. So palpitations, fast heartbeat, and sometimes chest pain will make you go get help. Others have chest tightness, shortness of breath. Some people tell me they feel like, what did you say?
Hyperventilating?
Yeah, they hyperventilate. Have you seen these people who come and say, I feel like there's a lump in my throat?
Yes, it's usually just an overwhelmed, diffuse physical state. So every part of them is excitable at that point in time, and it's just really hard for them to calm it down completely.
Yep. Some have told me they have diarrhea.
The stomach, yes.
Yep, and people have thrown up. So some feel lightheaded. I've seen a guy who his heart will beat so fast that he passes out. He just passes out, and people will help him, put some water on him, and then he feels better, but he knows. So what he does is he carries his medication in his pocket all the time. So all these symptoms will cause a lot of distress and affect the person's social life, the occupation, and affects the individual's functioning as well as family members. These are the clear symptoms of generalized anxiety disorder, and it affects a lot of people. Like we said, 40 million people in the United States. That's a huge number. But we're going to take a little break. Don't go away. Stay tuned. We'll be back shortly on Dr. Gilead's show. We're talking about generalized anxiety disorder. Stay tuned. I see, hey, Kelechi Esoga, I see you, Dr. Esoga from Florida. Thank you for tuning in.
Have you been meaning to get a massage but it keeps slipping your mind?
Oh, and Patience K. Thank you. You like the video, and I hope this is quite educational. Thank you for tuning in, and you can also ask your questions, and we'll be willing to answer them as much as possible to help you.
At Care Essence Therapeutics LLC, where our mission is to help you feel better, offer health information and education, and teach you to be an advocate for your health. We offer sports massage, medical massage therapy, workers' compensation, and auto injury claims. We're located at 7211 Hanover Parkway, Suite D in Greenbelt, Maryland. Please call us for our promotional package and membership rates. Our number is 202-689-4585. Again, it's 202-689-4585.
are there any diets to help fight anxiety? You can ask that when the show is back.
And be sure to like us on Facebook at Care Essence Therapeutic Massage.
The question should go to the guest. Then Bestie Desta says, hello, doctor. Don't worry, I'll send it to you right now.
Okay.
Have you ever wanted to get
Hey,
involved
Betty,
in
thank you
your
for,
community?
Betty Dexter, thank you for tuning in. That's Betty
I am
Dexter.
the president and founder of the Carolyn Parker Foundation,
Okay.
a 501c3 organization. We are focused on educating
So
and
there are
empowering
diets
our
that
youth,
could help.
supporting Alzheimer's research, and warming the hearts and souls of
Quickly
the
have a
home.
look.
If you would like to learn more information
Pauline
about our
Rose
programs
said,
and
"Hey,
upcoming
Dr. O."
events, please
Hey,
visit
Pauline.
our website,
How are you? Thank you for tuning in.
thecarolynparkerfoundation.org. Additionally,
Ernest
feel free to
Richards,
like
what
us
is the
on
topic
Facebook
for
or
the
follow
day?
us on Twitter. We can be reached at
Okay.
240-577-5757.
Generalized anxiety disorder.
Yep.
Generalized anxiety
Again,
disorder,
that's
Ernest.
240-577-5753. And we look forward to partnering with you.
429-9247.
Do you have a passion for service?
Yeah, if y'all got any questions, call in 301-429-9247. The topic is anxiety.
Yep.
A lot of people have it. So call in. You know, you get some free counseling this morning. So make sure you call in 301-429-9247.
Yep.
Back live in 30 seconds.
Ministries,
Betsy Desta,
or you can follow us on Facebook, Instagram, and Twitter. For more information, you can contact us at 888-289.
All right, Facebook about to go back live in 10 seconds. So call in with your questions. Don't be scared.
As we move out in the community to unleash the potential that lies within
5,
this space.
4, 3, 2. You are live.
All right, folks. Welcome back to Dr. Gilead Show. We are going live, streaming live on Dr. Gilead Show, and also at WBGR Radio. You can call phone number 301-429-9247, 301-429-9247. Ask your questions, and also you can type your questions, and we can answer them. Today we're talking on generalized anxiety disorder, and my special guest today is Ms. Carolyn Trotman. Ms. Trotman is a therapist, a licensed clinical psychologist,
Licensed clinical professional
professional
counselor.
counselor, licensed clinical professional counselor. She is big in anxiety. She treats a lot of people with anxiety and other areas she's going to tell us about later. So we have talked about the symptoms of generalized anxiety disorder. We've talked about how people can have it genetically or from the psychosocial part of it, from the environment. So now we are at the point where we want to talk about what do these patients do. So when patients have anxiety disorder, what do they do? And for you watching or listening, when you have your anxiety symptoms, what do you do? A lot of the people run to the emergency room because that is the thing that is something else. They think that they're having a heart attack. They worry, they are afraid. So they run to the emergency room and they get examined, they get tested, get EKG, like I said, sometimes even more detailed examinations like echocardiogram, because the feeling is like you're having a heart attack, like you're about to die, like something bad is about to happen. And people go seek help. Others will go to their primary care physician because they never feel well. There's that feeling of not being well, like something, an impending doom, that something is about to happen. And people get referred to cardiologists. They go back and forth. Others go to their GI, the gastroenterologist, because of the feeling like they're going to throw up, the stomach upset, diarrhea sometimes. And I've had people pass out and it's like they're having seizures. So they get referred to neurologists. So by the time they go to all these other specialists and They look, they can't find anything. They say, okay, you need to go to the psychiatrist. And by then, the patient would have suffered so much before they come to the psychiatrist, who can just adequately treat you with just few medications, and people feel better. So it is a torturing illness. People go through all kinds of things. They suffer before they finally go get help. And it's not their fault. It's just they go into the best place they know, to the emergency room, to their primary care. So this affects the individual, affects the family. But I want us to take a look at the effects of generalized anxiety on the individual. So I like Ms. Trotman to, well, let me take that. What do you think? How does generalized anxiety affect the individual who is going through this problem?
Well, just a sense of, sometimes I hear them talk about a sense of just helplessness, because they can't seem to get a handle on the worry, the excessive worry. That usually makes them isolate, which then affects, the way that they interact with their friends, their family, and just socialization on the whole. So when they're coming to me, they've usually kind of cut off their support system a little bit from helping and being there, because they're all caught up with their thoughts.
Okay, well, hold on to your thought. We have a caller. Hello.
Hello, doctor.
Hi, welcome to Dr. Gilead Show.
Thank you for taking my call.
Go ahead. You have a question?
Yes, I do. I was actually wondering, what's the best thing to do when you're in the middle of a panic attack and you're having trouble controlling your breathing?
Good.
Instead of running to the emergency room.
Okay.
It's suggested.
Right. So the caller asks, what do you do when you're in the middle of a panic attack? Of course, panic attack is another type of anxiety. What do you do when you are in the middle of a panic attack and you have difficulty controlling your breathing? We're going to talk about how to manage anxiety, but the commonest thing is, first of all, you take deep breaths. When you take deep breaths, it helps slow your heart down. It helps calm you down. You take in more oxygen, because it's been shown that when people have panic attacks, the breathing is shallow, so they are not able to breathe out a lot of the carbon dioxide. They have what is called hypercapnia, and that means increase in carbon dioxide in the blood, and that makes them more anxious. So the first thing is to take deep, slow, deep breaths. Once you do that several times and count it, take 10 deep breaths. A lot of the times it helps. Other times, if the panic attack is quite excessive, it may not help. Now, that is where you would have, if you have seen a doctor who has given you some medications, some quick-acting benzodiazepines, you take just a little of it, in 10-15 minutes, it calms you down, along with deep breaths. A lot of people feel better. But also, it's been shown that if you do quick exercises, you just take walks, get out, get clean, fresh air. It helps calm you down, because you're breathing in good, clean air with high oxygen content. You exhale deeper, carbon dioxide is removed, and a lot of people feel better. But the most important thing here is to get connected to a doctor who can give you some medications that you can hold on to. It's been shown that even carrying the medication in your pocket, in your purse, people don't have panic attacks. That is one of the ways that people get help. People really get better when they're having panic attacks. All right?
Thank you.
You're welcome. Thank you for calling in. Okay, Ms. Trotman, you were talking about the effect of generalized anxiety disorder on the individual. And you talked about how they feel this impending doom, danger coming, sense of helplessness. They feel like there is no help. Right. And a lot of the times they isolate, they stay away from people because it could be embarrassing for people to see you shaking, sweating, right. And people are going to be wondering. Having trouble breathing. They say, hey, what's going on with you? And we live in a society where people think every unusual look on somebody, they think you're doing drugs or something. Right. And so people say, hey, what you smoking? What you doing? But they do not understand that you're going through a torture, a painful situation. So people who have anxiety disorder or panic attacks, like the caller talked about, they feel this sense of something bad is about to happen. And they struggle, they isolate. A lot of the times they stay indoors. They don't want to come out because they don't want people to see them looking that way. That is, and what happens? They lose their job. They don't go to work.
Yes.
They lose their job.
They're no fun to hang out with.
Yep.
is what they hear. So it just affects their entire life. It's not just that they're feeling something internally, but it kind of projects out into other areas of their life.
Yeah, and of course, no spouse or girlfriend or boyfriend can take that.
Yes, it's difficult for a spouse or just a significant other to handle, and so sometimes it's helpful if the person does seek help and is connected to a doctor or a therapist, that they have the family come in to have a better understanding of what it looks like and what those symptoms are like and what's going on for their family member.
Good. So let's look at the next thing is the effect of generalized anxiety disorder on the significant order of the person that has it. And that means the wife or the husband, as the case may be, the partner, the children, the parents, co-workers, people in the society. How does this illness affect the people that hang around the person that has the illness? Because the guy or the person is feeling anxious, feeling restless, like Ms. Trotman said, they're not fun to be with. They are angry, they are irritable, they yell at the children, and the children will be wondering what's going on with mom. Why is dad sweating? Why is he acting this way? And it trickles down. It affects every member of the family. Now, if the patient is a breadwinner, is the main source of income for the family, what happens? They lose their job, or they don't go to work. They take unpaid leave. The family suffers, and because a lot of people can't really put up with a person like that, what happens? You have divorce. You have, once the person loses the support from the spouse, they become more anxious, they become more nervous, they end up losing their job, losing their spouse or significant other, they lose their house, they become homeless, and it just spirals down. It really brings the person to the lowest level unless they get help. And another question is, how does it affect our communities, our society in general? How does anxiety affect our country as a whole? What do you think, Ms. Trotman?
So I guess if we're just thinking about systems, and you brought up earlier hospital care and those frequent visits, that all plays out when we're looking at our insurance and paying for insurance. Insurance prices go up, premiums go up when they realize that they have to care for more people with this disorder that need frequent help. So, that's how it plays out in communities. But also when we're talking about families now partners separating, and how it affects the breakdown of the family when, someone is not getting help for this disorder in particular, but any kind of mental health treatment, and the family breaks down, that's a big deal. Now we're dealing with helping everybody cope with this separation, financial issues tend to pop up. So, you know, it's systemic, it's families, it's insurance, and other community things as well.
Wow. And I know you see a lot of couples in your practice.
Yes.
How much of anxiety do they come in with?
Actually, there are several couples that come in and they're having issues around maybe communicating, or just dealing with someone always expressing some level of worry about something, and the partner's having a difficult time reassuring the anxious partner. So, you know, they come in to work on that, and then you realize, okay, so this anxious partner hasn't been diagnosed as yet, and maybe that's something that they can individually get help for and get treatment for, but still within, you know, the support of the relationship and within the support of, you know, the couples counseling or the couples coaching. Just understanding where something is stemming from helps to build that relationship, and it usually can bring people closer. It's when you don't understand what's going on that makes it taxing.
Yeah, that's true. And I know you're doing some work on sexual disorders and doing some doctoral training on sexual disorders.
Yes.
Anxiety, how do you think that affects sexual activities in the family and all that?
Well, it's not going to be the first thing on your mind usually when you're anxious or worried about other everyday things. It's not going to be the first thing on your mind to be physically intimate with your partner. Also, if the anxiety is around being physically intimate with your partner, that's another issue to address, or a medical issue like a heart issue. You're now scared that something might happen while you're being physically intimate. That can also, you know, send the person into a more anxious state, and they'll refrain from doing that. So.
Right, and also in my practice, I see people with sexual disorders. Of course, when you're having anxiety disorder, you can't get an erection. It's impossible for you to get an erection. Even if you get an erection, what happens? You get premature ejaculation. It's all a problem, and the spouse can't take it. Even the female, you're going through this torture of nervousness, and you can't be talking about sex at that time. So it breaks families, and before you know it, the whole family dynamic is completely destroyed. So the anxiety disorder is one of those illnesses that affect our life, affect relationship, affect sexual performance and relationships. So it is something that is serious, that needs to be taken care of. There was someone had just sent in asked for us to touch more on the medical diagnosis, how some medical problems could be misdiagnosed, or how anxiety could also be related to other somatic problems, like hypothyroidism. What happens is when the thyroid is hyperfunctioning, when the thyroid hormone, the thyroxine, which is T4 especially or mostly, is high, because thyroxine increases your metabolic rate, it increases your heart rate, it increases the general body function, it increases body temperature. So the person who has hyperthyroidism is feeling high, like they're smoking something, like they just took amphetamines or cocaine, and they're hungry all the time. They're feeling nervous, shaky, and even when the air conditioner is on, everyone is feeling cold, they are feeling hot. That is hyperthyroidism. And you need to get a good doctor to see you and take all the blood work, do the evaluation and the examination, examine your thyroid, get the blood work, look at your thyroid hormone levels, and also the thyroid stimulating hormone. All this will help clinch the diagnosis of hyperthyroidism. And once the thyroid hormone is brought to a normal level, all that feeling will go away. Also, people who have lupus. Lupus is an autoimmune disease. It's an autoimmune problem where people develop antibodies to their own cells, and they have pain. They have this feeling of unwellness. They have difficulty sleeping. They feel restless. They just can't put their finger on what is going on. So they feel nervous. They feel anxious because they don't know what is going on. They think they're gonna die, but once they get the appropriate diagnosis, maybe see the rheumatologist and get the blood test done, and they put on the right medications, they feel better. There are so many other illnesses that can also present with symptoms of anxiety, but these things, they need to be appropriately diagnosed, and once you get the right treatment, people feel better. All right, we're just going to quickly run to treatment. How do you treat someone who has anxiety disorders? There are two ways, what we call pharmacological treatment, medication, and also psychotherapy. The major medications that are used to treat generalized anxiety are things like buspirone, then you have benzodiazepines. You also have SSRIs, which are medications that we use to treat depression as well. Like I said before, depression and anxiety kind of go hand in hand in a lot of people. They co-occur with each other. Now, the main problem with using benzodiazepines is people get addicted to it. People come to me and they say, I have anxiety, I have panic attack, I need Xanax bars. And Xanax bars, what do you mean Xanax bars? They just want Xanax because they were feeling that way and a friend gave them something, maybe a little Xanax or a benzodiazepine, they take it and they feel calm. The treatment modality is start a little benzodiazepine along with Paxil or Zoloft, then gradually take away the benzodiazepine. Once that is done, the Paxil or the Zoloft will maintain the stability of the anxiety. People feel better over time. But the problem in our communities is that people are used to taking benzodiazepines for even the simplest feeling of nervousness. And once your body is used to taking those medications, today, for example, 0.5 milligrams can keep you calm. 2 weeks, your body becomes dependent on it. You develop tolerance to it. 0.5 milligrams can't do it anymore. You come back to the doctor and ask for more. People come to me, oh, doctor, the medication you're giving to me is not working anymore. And I say, look, we can't go up more than that. He says, oh no, I can't do this. And people have gone to another doctor because I refuse to increase the dose. We try to use other more conservative ways of treating anxiety instead of the medication so that people don't get addicted to it. And we know that benzodiazepines can really affect your memory over time. So you're better off just getting better early on benzodiazepines, and quickly your doctor takes you off it. If your doctor is not taking you off it, ask that you be taken off it, because at the end of the day you become dependent and it becomes much harder to stop the medication. There are other medications we use, things like propranolol, which is an antihypertensive that has been shown to help calm people down, reduce the anxiety, reduce the nervous feeling. You have things like antihistamine, even simple hydroxyzine, which we use for itching and for even when people have a insect bite that causes some swelling and all that. Simple antihistamine will also help calm people down. But I want Ms. Trotman to talk about the other conservative way of managing anxiety disorder, which is psychotherapy, which is what you do.
Yes.
Yeah, what do you do exactly in psychotherapy? What kind of therapy do you do to help the people manage their anxiety?
Well, I come from a cognitive behavioral approach, and I really try to look at the whole person as well. So even with my cognitive behavioral approach, which is looking at how your thoughts affect how you feel, then affect how you behave, I'm also looking at helping you understand the relationship between your mind and your body, especially with anxiety, because there's an overwhelming physical issues that come along with it and physical symptoms that come along with anxiety. It's very important to empower people to understand that they're in control of some things, or they can take back control of some things that are going on with their body. So I try to talk to people about some of the symptoms of, let's say, a panic attack or anxiety attack, around the rapid heart rate, the fast, shallow breathing, and like you told the caller about the deep breathing. But just doing it when it's happening, yes, that's a good thing, but learning how to do it on a regular basis and just practicing that. So I usually teach my clients how to deep breathe and how to belly breathe, because that's more important. So just teaching them to kind of, if they've had children or they know how children breathe, they breathe from their stomach, they don't breathe from their chest. Mm-hmm. Chest breathing is shallow. It's something that we do as adults, but kids, they breathe from their stomach. So there are different apps that I would ask my clients to download so that they can practice outside of the office. I also have them practice certain exercises around experiencing whatever the physical symptom is that worries them, experiencing that on purpose. So if it's rapid heart rate, do a few jumping jacks, get your heart rate up, and practice slowing it down so that feeling is not unfamiliar to you and you can, get back into control. Also, if you're able to do jumping jacks in the middle of a panic attack, that usually it's a panic attack. You're not going to die. You're not dying at that point in time. You're able to still be in control of your body. So I try to keep people in tune with the mind and body relationship.
Yeah, you also talked about cognitive behavioral therapy. What is cognitive behavioral therapy? How do you really do it?
So we explore what some of the thoughts are that they're dealing with. So the excessive worry, what are some of the thoughts that come to their mind, and where might that have come from? And is that something stemming from right now? Is that something stemming from something in the past? Is this a learned way of thinking? And so now how do we break that cycle? How do we refute some of those thoughts that are, causing some level of debilitation, like, stopping people from being able to function the way that they want to function because they're tuned into those thoughts. So we're usually looking at the thoughts and then the emotion that comes along with the thought and then how that plays out in their behavior.
Wow. And a lot of people have gone through some trauma in their life.
Yes.
And once every time they go through that same feeling, their heart begins to beat fast, and it precipitates anxiety. So I'm sure you teach them how to, get their minds off that and not to focus on what they've gone through in the past.
True. Not necessarily not to focus on it. Maybe in therapy we are a little bit more focused on it, only because if it's something that they haven't been allowed to talk about or to express, that's the venue where they do get to kind of talk about it and express it with no judgment about what happened, just them giving their narrative on what's gone on. If it happens to be overly distressing, we'll play out certain parts in the therapy, not necessarily play out like acting, but process through certain parts of, what about the situation was most distressing, and break it down into bite-sized pieces.
Wow. Do people really get well from therapy?
I can't believe you asked me that. Of course. Of course, I believe that. That's why I do what I do.
That's why you do it, I guess. Yeah.
So I love it when I have a client and I've been working with them for a while, and then they no longer feel like it's necessary to see me because they feel better.
Good.
And they're doing better, and they've learned some skills that they can use on their own. And that's the goal of therapy, not necessarily for you to have to come back all the time for the rest of your life, but for you to gain some skills in life that you can use on your own to empower you to be able to do that out in the community and use me less.
I can imagine how you feel when people say, I feel better. Can we cut back to once a month instead of every week? That shows the good job you're doing. Yeah.
Yeah, it's good for me, but it's even better for them.
Exactly.
Because then, it helps to reduce that stigma of going and seeking help. They'll talk this word of mouth, hey, you might want to try going to a psychiatrist, or hey, you want to try going to a therapist, and it normalizes it in the community. And even with the numbers that you were giving earlier, hopefully that normalizes it for people, that more people are going through it than you recognize or So seek help. That's healthy to seek help.
All right. So what do you, when people have anxiety disorder, generalized anxiety disorder, the individual that has it, family members, what are the resources out there? What would you advise them?
Well, to start, it's okay to Google and to look up different things to help you deal with anxiety. If you are having an issue dealing with these symptoms on your own, then you should definitely seek help. So seek the psychiatrist, seek a therapist, talk to your primary care physician, because you do want to rule out and make sure it's not something medical going on.
Yep.
And that's what I usually advise as well. I want people to go get a thorough physical, and tell their doctor what I've said, just so they can check all the right things. And so coming in and seeing somebody and learning some tools and techniques.
Okay, well that's good. And we know from statistics that there is help out there. There are medications that help, and like Ms. Trotman said, CBT, psychotherapy, supportive therapy, in combination with medication, sometimes therapy alone can help people. So no one should really suffer from anxiety. If you have it, or you know a family member that has it, ask them, help them get help. Help them, refer them to somebody. But first of all, we make sure it's not a cardiac problem. It's not any of the major medical problems that could cause, lead somebody to die or any of those. Once you've ruled out any of those medical problems, go get help. There is no, we cannot be ashamed of going to get help. Help is out there. Don't feel bad. Get out there, seek help. Google, look for people. There are psychiatrists who specialize in things like anxiety. There are therapists who that is their areas of focus. Once you find any of those, go to them. Ask your primary care physician to refer you, because you can really get help. It does not help isolating, staying in your room because you are afraid when you get out there you may have an anxiety attack, and because of that you don't go to work, you don't interact with people. What happens is you get worse, you get sicker and sicker and sicker every day, and it becomes a big problem to tackle when you could really have gotten help early enough and began to live a normal, good life. So there is help out there. Go seek out and get help. Ms. Trotman, anything else you want to tell our viewers today and our listeners?
I think you've covered it. That just, make sure that you tap into all the resources. You're not alone if you have this diagnosis, and there are people who enjoy helping and want to help you through this. So, seek help.
Yeah, so if someone wants to find you, where can we find you? How can people get to you to get the help that you give to people that have anxiety disorder?
Okay, so my practice is Trotman Psychotherapy and Consulting, and I am located in Atlanta, Maryland. I can be reached by telephone at 240-245-0470 or ctrotman11@yahoo.com. Also, for the couples who are dealing with this, I work with a team called the Relationship Boosters. And
What is that called?
The Relationship Boosters.
Relationship Boosters?
Yes.
What is that about?
Well, it's about just building healthy, happy couples of any status.
Huh.
So from, dating status to married status, we work with couples and just building that relationship. And so, yeah.
So people who are just trying to know themselves, dating, not yet married, they can come and...
We do offer individual services for that, but if people are, in their later stages of dating and looking at just being more compatible in communication, we work with those couples.
That's good. Good job. And of course, I'm a psychiatrist. You know by now. I'm located in Lanham, right here. It's 9470 Annapolis Road. The suite number is 117, and you can call us on 301-577-9111, 301-577-9111. But I want to really extend my appreciation to Ms. Trotman for coming to share her experience today with us, and also Patience K, Betty, Dexter, Dr. Isoga from Florida, also Mr. Isoga. Thank you all for tuning in today. Please, I'd like you to look at our Facebook page, and that's Dr. Gilead Show on Facebook. You can also follow us on Twitter, and we are also on YouTube as well as Instagram. The show is called Dr. Gilead Show. We meet every Thursday, 1 p.m. Eastern Standard Time. Join us same time, and we are at WBGR Radio. You can call in during our show on 301-429-9247. Thank you for tuning in today. Thank you very much. We'll see you again next week, Thursday at 1 p.m. Thank you very much. Thank you, Ms. Trotman. That was very good. Thank you very much. I think a lot of people benefit from the job.
Bye, folks. All right, tune in tonight, 7 o'clock, to perform here on WBGR.
All right. Thank you very much. Thank you, everybody, for tuning in. Thank you. Thank you, Ms. Trotman. It was a good job. I mean, a lot of people have
so Brandon is the owner of
anxiety. I think what you do, you're helping a lot of them. So we hope that people will ask for help as we have advised them and get the help that they need so that they can benefit from it, save time and money. Yeah. Thank you very much.
I got gold and black shirts for us to do this year. This is